Nanoparticles which are developed for medical uses are small particles which may contain a drug, a diagnostic agent, or both. Just how small are nanoparticles? Imagine the Earth compared to a soccer ball. Now, a similar ratio exists between the size of a soccer ball and a typical nanoparticle. Our group develops nanoparticles for imaging of brain diseases. Nanoparticles are attractive for us because we can target them to the brain or even to specific brain structures. We can do it by controlling their size, their surface characteristics, even their shape. We can also direct the nanoparticles to specific receptors, transporters, or other targets on the cell membrane or within the cell. Many drugs and diagnostic agents normally do not enter the brain and remain within blood vessels. One of the advantages of nanoparticles is being able to overcome this limitation and deliver the diagnostic agent into the brain. Our nanoparticles are aimed to identify inflammation within the brain. Inflammation may be the cause of brain diseases, the result of the disease, or both. One of the best examples of brain inflammation is cerebral malaria. Cerebral malaria is the most severe neurological manifestation of malaria, killing over 1 million people worldwide every year. Early diagnosis of this complication may reduce patient morbidity and mortality. We use a mouse model of cerebral malaria in which mice are infected with malaria parasite. In this model, our nanoparticles distribute better into the brains of infected mice compared to healthy mice. In the cerebral malaria model, we can see the nanoparticles almost in the entire brain. In other brain diseases, we use our nanoparticles to localize the diseased brain region. One example is epilepsy.
Epilepsy is a very prevalent disease. It affects about 1% of the population around the world. Epilepsy is the tendency to have epileptic seizures. And epileptic seizures are caused by abnormal electrical activity in the brain. This abnormal electrical activity in the brain, this brainstorm, if you may say it, the way we diagnose it is by hearing the history of the seizures from the patient himself and from the family or other people who were around when he had seizure. And we also use other diagnostic tests like EEG and MRI, but they are not always conclusive. We don't have a good biomarker for the disease. 70% of patients with epilepsy are free of seizures when they are treated with anti-epileptic drugs. But 30% of these patients will not gain seizure freedom with medications alone. And we can offer them other types of treatment, such as surgery.
Surgery can improve their quality of life in a significant way and sometimes even save their lives. So with the help of nanoparticles, we may best localize the epileptogenic zone while avoiding the functional areas of the brain.
We use a rat model of spontaneous seizures to mimic the human condition of chronic epilepsy. Our nanoparticles are targeted to the epileptogenic brain tissue, the tissue that actually generates the epileptic seizures. Before we use the nanoparticles in the epileptic rat model, we characterize them in tissue culture. When our nanoparticles are injected into the rat veins, they are uptaken by cells which are involved in the inflammation in the brains of these rats. We believe that in the future we will be able to modify our nanoparticles such that we will be able to use them for diagnosis of other brain diseases such as Alzheimer's disease, multiple sclerosis, and even autism or autistic spectrum disorder.